Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the proliferative lesions which show relative risk of developing breast carcinoma or invasive breast carcinoma? So if you see the relative risk, if presence of non-proliferative changes, there are some non-proliferative changes are present. These non-proliferative changes are around 70%, and the relative risk of these non-proliferative changes, the relative risk present in this non-proliferative changes is 1, and these include adenosis, cysts and apocrine change, ductal ectasia, mild epithelial hyperplasia. Then we have proliferative disease. If the patient has proliferative disease without atypia, if there is proliferative disease without any atypical features means if there is no what do we say, mitosis, no increase in mitosis, there will be nucleus cytoplasmic ratio is normal, so there is no atypical features are there, then the relative risk is around 1.5 to 2%, but there is multiplication of cells or proliferation is seen here. So examples are, there is hyperplasia of usual type. So in the hyperplasia of usual type we have moderate or florid hyperplasia of usual type or papilloma, or we have sclerosing adenosis. So all these are proliferative diseases without atypia. Then we have proliferative diseases with atypia. So obviously these have atypical changes or anaplastic changes are seen in the patient. So these proliferative changes with atypia are seen in 4%. In these changes the relative risk here is around 4 to 5, and here these mainly include two disorders, that is there can be atypical ductal hyperplasia is seen, and we have atypical lobular hyperplasia is seen. So this atypical ductal hyperplasia or atypical lobular hyperplasia has allowed 4 to 5 fold increased risk is present. Then we have carcinomas. If there is ductal involvement is seen, if the ductal involvement is seen by cells of atypical ductal hyperplasia, if ductal involvement is seen by cells of atypical ductal hyperplasia, then there is 7-fold increased risk. Whereas if you see, if the patient has lobular carcinoma in situ, it is an in situ carcinoma. For it to develop into uh, a normal full-blown carcinoma, there is 10-fold risk. Similarly, if there is ductal carcinoma in situ, also has 10-fold risk of development into full-blown carcinoma.
thank you and thank you for watching.